I am Dr. Sanjeev Kapoor, consultant rheumatologist. I specialize in diseases which is known as arthritis primarily. That is a disease of musculoskeletal system which involves. Now, today we are going to talk about rheumatoid arthritis. Why rheumatoid arthritis occurs? So, the etiology of rheumatoid arthritis is autoimmune. That means our immune system works against our own system, that is mainly the synovium of the joint, and it tries to destroy it. It is something like that some trigger has happened and our immune system recognize the joints as a different source. That means that it thinks that it is from the outside source and it tries to destroy it. So this is how it has happened. It has some genetic predisposition also. There are two genes which are involved in this, and later on there are some triggers by which this disease starts in the joints itself. The triggers, one of the most important trigger is smoking. That means those people who have the genetic background for the disease, and if they smoke, then this disease is triggered and causes inflammation in the joint and later on destruction. And it is a very destructive disease in the sense that it causes a lot of dysfunctionality in the patient, and patient is not able to perform their daily activities, and later on we have to replace the joints also. And not only that, it is a life-threatening also. It has been found that in rheumatoid arthritis, around 10 years life expectancy is reduced in those patients who are not well treated within time with the treatment gadgetry which is involved at this moment in time. Now, at this moment in time, who are the patients who are prone to develop rheumatoid arthritis? What we say is that male-female ratio, if we see, then the females are more prone to develop rheumatoid arthritis, and the ratio is around 4:1. That means the 4 females are affected, then we find that 1 male can also be affected. So there is some hormonal disbalance in the females which make them predisposed to this disease which is rheumatoid arthritis. Now, I will talk about what are the early signs of rheumatoid arthritis. As we know that today there are a lot of medicines and as well as the gadgetry is present in our armamentarium to almost cure the disease or control the disease. But the problem in India is that the most of these patients come to us very late when the disease is already sets in. We said that if patient comes within the 6 months of time, then and with the proper treatment for our guidelines, we can treat them, and even the patient can achieve remission, and not only remission but what we call drug-free remission. That means patient is drug-free also. So early diagnosis is very, very important. So that is why I want to highlight what are the early symptoms of rheumatoid arthritis. Early symptoms are morning stiffness. That means patient is stiff in the morning. There is a difficulty in the hand joint, so that making a fist is difficult. So this is probably the first symptom, that patient has morning stiffness which is lasts more than half an hour, and as the days pass, symptoms become better and patient is able to do all the work. Second point is that if we see the swelling in the hand joint, whether in the wrist joint or whether in the finger joint, that is a very, very early sign of rheumatoid arthritis, and usually it affects both the hands. So if any joint which you feel that there is a swelling in the hand joint, then it is an early symptom of rheumatoid arthritis, especially in the female. That means the age group in which menses is taking place, and that is the age group where the rheumatoid arthritis sets in. So I would highlight that usually if we think that the arthritis is a disease of old age, so that is a different disease, that is osteoarthritis, which affects the knee joint rather than the hand joint. So hand joint arthritis, swelling in the joints, and with the morning stiffness more than half an hour is early sign. We should suspect that patient has rheumatoid arthritis. Now, once this patient has rheumatoid arthritis symptoms, they should come to a rheumatologist instead of going to here and there. And believe me, there are very good treatments are available, and going to other specialty, it will be a waste of time, and that will delay the diagnosis and the treatment. What we do first for the investigation part, we take the history examination, and on history we see that all the symptoms, that is morning stiffness more than half an hour and hand joint, and on examination if we see the restriction of the movement or the swelling is there in the joints, then we clinically suspect that yes, you have rheumatoid arthritis, and we order 3 tests, important tests, that is ESR, which shows sedimentation rate, which increases due to inflammation, C-reactive proteins, which are also increased due to inflammation, and rheumatoid factor, and another factor that is anti-CCP. If one of them is positive, then we suspect that you have rheumatoid arthritis, but it is more of a clinical symptoms and signs which gives this diagnosis rather than the investigation alone. Nowadays, there are other investigations which are available and which can detect early, is ultrasound of the hand joints, and as well as on the case basis, even the MRI of the hand joint, which confirm our diagnosis that patient has inflammation in the joint by looking at the synovium more clearly on the ultrasound or the MRI. But primarily, I can say that with the experienced physician and rheumatologist can diagnose these kind of patients. Only the clinical examination is sufficient and the history is sufficient in 80% of patients, and 20% of patients may require. The reason why I am saying this is that sometimes what happens is in early stages, rheumatoid factor can be negative, anti-CCP can be negative, ESR can be normal, and in 30% of patients, all along it can be negative also. So on suspicion, we can diagnose as what is known as seronegative rheumatoid arthritis, where the blood is not showing any feature of rheumatoid factor positivity or anti-CCP.